As an OBGYN, I often see osteoporosis in the clinic, and I know you're Googling those questions. I wanted to create this video so that I could answer those questions for you. So let's get into it. If you're new to my channel, my name is Dr. Odunsi, and I'm a board-certified OBGYN. I created this channel because I want you to feel empowered when you visit your physician, whether that's a primary care physician or an OBGYN. I want you to have the answers to the questions I know you're Googling. The first question is, why is osteoporosis the silent disease, and what can you do to catch it before it's too late? Osteoporosis is a silent disease because typically what happens is a patient will have some sort of injury that either takes them out or causes severe pain. And the changes that happen are gradual. For example, we all reach a certain height, and it's hard to notice when you're getting shorter if you see yourself in the mirror every day. So what I see in patients who have osteoporosis is that their stature gets shorter and shorter and shorter. So I may notice it because I'm seeing the patient every year. However, a patient may not notice it because they're looking in the mirror every day. The second thing is typically fractures happen, and that's going to cause a lot of pain, and it also may cause some sort of temporary disability or permanent disability. And the thing that is the triggering event is a sudden fall or a sudden trauma. So that's why it's called a silent disease. Are there things that could be pushing you towards osteoporosis or putting you at risk for osteoporosis? The answer is yes. First would be nutritional things. Are you deficient in vitamin C, vitamin D? And those two actually work synergistically where they help to retain bone mass. The second is, how is your movement? Some exercises are better for retaining that bone density. The main one is weight-bearing exercise. So for my patients who want to retain muscle mass, I suggest you could do something that doesn't involve going to the studio. You can wear ankle weights, you can wear wrist weights, and just do your day-to-day activity. You can also wear a weighted vest, and that way you're getting the weight-bearing exercise without having to go to the studio. You can order them on Amazon. The last thing that we do address in our visits is smoking and other toxic habits that may be leaching bone. I use that word because that gives a visual representation of what's happening with smoking. So one of the lifestyle modifications patients can make if they are smoking is to cut down and eventually eliminate the smoking. Additionally, I want to ask my patients if they are on chronic steroids, because steroids can also cause weakening of the bone. So I do a thorough history to see if there are any medications that could be altering the bone health in my patients. Should you get a DEXA scan? When should you get it? And are there any medications that you can take to prevent osteoporosis or to help manage your osteoporosis if you already have it? The DEXA scan recommendation is age 65 for postmenopausal women. The caveat is if you have risk factors for osteoporosis, if you already have osteopenia much earlier, if you've already had a significant fall with a fracture, we may do the DEXA scan earlier. Osteoporosis is a huge topic that needs more time for discussion. I want you to feel reassured that you're not the only one going through this, but I also want to prevent big scary things like that big fall that may put you out of commission for a little bit. So be sure to start weight-bearing exercise if you haven't already. Add that calcium and vitamin D if you haven't already, and talk to your OBGYN about a DEXA scan if you're already at the age of 65. That will give us a baseline evaluation of how your bones are doing and if there's anything we need to adjust in your day-to-day and your lifestyle. If you like this video, this is a topic that I like talking about. I want you to leave a comment, leave your questions down below, and subscribe. And I will see you in the next video. Bye.